my name is Dr. Ezekiel Oburu. I'm an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and today I would like to talk about some of the devices that we use in practice, specifically about some of the devices that we use when a patient has a problem in the foot. So an orthotic device is it's a musculoskeletal device that usually you may wear, for example, in your shoes, that will enable you to correct either an abnormal way of walking, and it may help alleviate either pressure or pain. So I'd like to talk about some. This is an orthotic device that's a heel cushion, and there are patients who've got certain conditions, like for example a patient may have plantar fasciitis. This is quite useful if you have plantar fasciitis, because what it does, it cushions the heel, and therefore you don't have as much pain, and you can use it for both sides, the right, the left, or the right. You may also use it in certain conditions, not necessarily even plantar fasciitis. Even if you have insertional Achilles tendinitis, you may use this because it will give you a small wedge and it will enable to release the tension in the Achilles tendon. This is a toe spacer. Sometimes when patients have got conditions such as hallux valgus and they are thinking of maybe delaying the surgery, this may help separate the big toe or the hallux from the other toes. So you can see that is the spacer over there. So that's the toe spacer. Sometimes also after hallux valgus surgery, during the healing process, we may also elect to use it, although some surgeons don't use it. This is really another silicone, but this is a full sole orthotic, and we may use this because it has a slightly more wedge here. We may use it especially if the patient has got pain, various aspects of the foot. The patient may have a flat foot and they're having a bit of pain and they don't want to consider anything drastic. We may use this. This is a metatarsal pad. Now a metatarsal pad enables you to offload the metatarsal head. You may have pain that is in the region of the metatarsal head, and this pad really will enable you, when you wear it through the toe there, it will enable you to offload the metatarsal head and therefore reduce the pain. This full sole orthotic device is a custom one, and these custom ones are different types. You may choose to have even a lateral wedge, like is the case here. On occasion, we may even have a medial wedge. So a custom device depends on what the surgeon is trying to achieve, and there may be different wedges depending on what the pathology that the patient has. And this here you may have seen, or this is like for a child and this is for an adult. This is what is known as an ankle foot orthosis, or some people call it an A4. And various times, or when somebody has got weakness, let's say weakness on walking, has a foot drop, we may sometimes elect to use this. Sometimes in children who have got tightness of an Achilles tendon, or even an adult, we may do what? We may use this after we stretch, or sometimes even in children who have got spastic conditions like cerebral palsy, and you have stretched it and you've gotten correction, you may decide to use this. So this is the adult version of it. So these are just some of the orthotics that we use. I mean, there are others that I've not mentioned about. I saw a child today with sesamoiditis, and I advise the parents to get a dancer's pad, which is quite useful. You may have one for which is stiff, for Morton's neuroma, and there are many others. But in brief, not all conditions need surgery. Sometimes we just give you an orthotic device and that is able to solve the problem. Thank you very much.